Let's take a look at the warm-up review, and there's just one question. What are the three different G proteins and what are their downstream effects? So there's GQ, which activates phospholipase C, and then phospholipase C ends up generating IP3 and increasing intracellular calcium. Phospholipase C also generates diacylglycerol, which activates protein kinase C. Then there's the GS protein, which stimulates adenylyl cyclase, and then adenylyl cyclase converts ATP into cyclic AMP, which activates protein kinase A. And the third one is the GI protein, which inhibits adenylyl cyclase, and that decreases cyclic AMP production and decreases protein kinase A activity. And then which receptors use these G proteins? Well, GQ is used by the HAV1 M&M receptors, H1, alpha-1, V1, M1, and M3. GI is used by the MAD2s, M2, alpha-2, and D2. And then all the other receptors we talked about use GS proteins. So that's beta-1 and beta-2, D1, H2, and V2. So that's it for this warm-up. Now let's move on to the lecture.
Hey guys, Dr. Carmichal here, and in this lecture we're going to be looking at seizures. So what's the difference between a partial seizure and a generalized seizure? Well, partial seizures indicate that it's occurring only in one part of the brain, and it kind of says that in the name. Classically, this is in the temporal lobe, and typically these are preceded by an aura. One classic aura is the smelling of burning rubber or burning tires, but auras can be many things like tunnel vision, deja vu, or euphoria. The next thing we need to know is the difference between a simple partial and a complex partial seizure. Again, both of them are staying in one part of the brain. The simple is referring to the absence or alteration of consciousness. So these patients have intact consciousness. A complex partial seizure is when there is an alteration of the consciousness. So what about a generalized seizure? Generalized seizures affect the whole brain diffusely. They can start as a partial seizure and then can generalize. And most seizures do start out in the temporal lobe and then generalize to the rest of the brain if it's going to generalize at all. What are the different types of generalized seizures? Well, there are many types actually. First is the absence or petit mal seizure, and these can present as a staring spell or a blank stare, and sometimes it's associated with the smacking of the lips or slight quivering movements of the facial muscles. And after the seizure, then the person goes right back to doing whatever they were doing and often are not aware that the seizure occurred at all. So, after an absence seizure, patients generally do not have a post-ictal state. Myoclonic seizures present as a brief involuntary twitch of a muscle group or group of muscles. This is what people do right as they're about to fall asleep, only they're doing a lot of that. Tonic or clonic seizures, which are classically what we think about when we think about a seizure disorder, is the grand mal seizure. Here we see stiffness and shaking and the usual convulsive presentation that most associate with a seizure activity. Tonic seizures are characterized as just muscle stiffening without the shaking, and atonic seizures are sometimes called drop seizures. These patients will rapidly lose muscle tone and just fall down. They are often mistaken for syncopal episodes or falling. Sometimes patients will come in complaining of fainting, and in fact, they're just having atonic seizures. Status epilepticus is not actually a type of seizure, but a life-threatening episode of a continuous seizure where the seizure or group of seizures persist for over 5 minutes. This is always considered a medical emergency and can lead to permanent brain damage and death. So what causes seizures? This can vary depending on the age. A large percentage of seizures are idiopathic. In children, a developmental etiology is most common. Other pediatric causes of seizures can include infections, typically with a febrile seizure. Febrile seizures are benign and usually self-limiting. You can also see seizures with trauma and metabolic abnormalities. In adults, we see more common causes due to tumors or stroke, but you can still have the trauma or infection as a cause. As we get even older, stroke becomes the most common cause of seizure. Let's talk about some other disorders that can be associated with seizures. Specifically, let's talk about tuberous sclerosis. So tuberous sclerosis is an autosomal dominant disorder. There is incomplete penetrance and variable expressivity. So one person's tuberous sclerosis may look very different from another person's tuberous sclerosis. Most common mutation you're going to see is the TSC1 or 2 gene. So TSC for tuberous sclerosis is not too difficult to remember. Here we see a mutation in the hamartin or your tuberin proteins. And the classic triad for tuberous sclerosis is seizures, intellectual disability, and angiofibromas. Additional findings include hypomelanotic macules. These are referred to as ash leaf spots on the skin, retinal hamartomas, and cortical tuberous that are glioneuromal hamartomas, renal angiomyolipomas, cardiac rhabdomyomas, and astrocytomas. Sturge-Weber is a congenital neurological and skin disorder that is caused by vascular malformations. The most notable characteristic is the port wine stain on the face. The lesion originates in the first and/or second division of the trigeminal nerve. The rash can cover most of the forehead and face. The port wine stain is caused by an overabundance of capillaries and is present at birth. Sturge-Weber is caused by mutations in the GNAQ gene, but is not an inherited disorder. The vascular malformations can also result in glaucoma, seizures, hemiparesis, and intellectual disability, because where there should be brain, there's capillaries. Let's talk about trigeminal neuralgia for a second, because this is another hyperexcitable disorder. It's not really a seizure, it's just a problem with the trigeminal nerve. But the reason we're talking about it here is that we use our seizure meds to treat it. Trigeminal neuralgia is known as tic douloureux, and with this one you're going to have a lightning, horrible pain along the division of the trigeminal nerve, usually at the maxillary, that's triggered by things that like a light touch, wind, bed sheets. It's a very severe pain that's associated with a very light touch, and again we treat this with anticonvulsants like carbamazepine, phenytoin, gabapentin, and topiramate. Refractory cases, there might be a surgical option. Now let's talk about anti-seizure medications. You don't need to know the detailed pharmacology associated with each of the anti-seizure meds. One problem we run into is that many of the anti-seizure drugs can be used for almost any type of seizure. We have the older anti-epileptics like phenobarbital, phenytoin, carbamazepine, ethosuximide, divalproate, and valproic acid. They've been around and have been the primary treatment for decades. But we have a newer generation of drugs, gabapentin, lamotrigine, topiramate, levetiracetam, oxcarbazepine, zonisamide, which are being used with more and more frequency. So you're unlikely to get a question that asks you what's the best anti-seizure drug for a generalized seizure. There just isn't enough evidence for just one drug to be considered first line. There are a few exceptions where there's one or two drugs that are more often used in certain situations, and we're going to cover those. If you look at the mechanism of action of the anti-seizure drugs, you'll notice that they really only work at three different things. First, they block sodium channels. By blocking sodium channels, these drugs are decreasing the generation of action potentials in the neurons. These drugs include phenytoin, carbamazepine, lamotrigine, topiramate, and valproic acid. Second, some drugs will increase GABA activity. Remember that GABA is the chief inhibitory neurotransmitter in the CNS. Again, this will decrease neuron excitability and decrease seizure activity. These drugs include gabapentin, phenobarbital, valproic acid, benzodiazepines, tiagabine, vigabatrin, and levetiracetam. And then the third mechanism is blockade of T-type calcium channels. Again, simply speaking, these drugs decrease the neuronal action potentials. These drugs include gabapentin, ethosuximide, and at very high doses, phenytoin. I would try to remember which group of drug falls into each category, and you'll notice that there are a few that fall into multiple categories. So as I said before, there is a lot of conflicting data on which anti-epileptic is most effective for partial or generalized seizures. There was a large study called the SANAD trial that found valproic acid to be the drug of choice for generalized epilepsy and lamotrigine the drug of choice for partial seizures. But again, I don't think you'll have to make that determination on your test. So we don't spend all day talking about each and every drug and their individual differences. I'm going to go through the study guide questions and that are the highest yield material. First, what is the drug of choice for absence seizures? This is one example where we actually do have an agreement on which anti-seizure drug is best, and that's ethosuximide. If ethosuximide fails, then you can use valproic acid. Next, what is the treatment of status epilepticus? If you have a patient that comes to the ER with a seizure, status epilepticus, the drug of choice is going to be a benzodiazepine, like diazepam or lorazepam, and then you will load phenytoin. Next, what is the treatment of eclampsia? Remember that eclampsia is a seizure during pregnancy, which is associated with elevated blood pressure and again is a very dangerous and high morbidity mortality situation. Unlike status epilepticus, you don't start with the benzodiazepines. If you have eclampsia, magnesium sulfate would be the first thing that you reach for, and in certain cases, if that wasn't sufficient, then you might reach for a benzo like diazepam or lorazepam. The ultimate treatment for eclampsia is immediate delivery of the baby. Once the seizing has stopped, you want to get the baby out as soon as possible. Next, the additional side effects of phenytoin. All the anti-seizure drugs have side effects that include lethargy, ataxia, dizziness, headache, weight gain, and diplopia. Phenytoin has more interesting side effects and they're pretty high yield. The phenytoin side effects mnemonic is phenytoin has given MDs frustration, peripheral neuropathy, hirsutism, gingival hyperplasia, megaloblastic anemia due to decreased folate absorption, drug-induced lupus, Stevens-Johnson syndrome, and fetal hydantoin syndrome. So what is fetal hydantoin syndrome? Well, with this you have a cleft lip, a cleft palate, congenital heart disease, and you can have intellectual disability with developmental delay. Next, which anti-epileptics are teratogenic? So this would be phenytoin, carbamazepine, and valproic acid. And valproic acid is especially known for causing spina bifida when women need to be on even larger amounts of folic acid if they're going to continue to be on one of these anti-seizure medications. Next, what drugs cause Stevens-Johnson syndrome? There's a lot of seizure drugs that can do this. There's another great student mnemonic for this too. Steve Jobs made Apple PCs. Apple PCs, allopurinol, phenytoin, phenobarbital, lamotrigine, ethosuximide, penicillin, carbamazepine, and sulfonamides. Next, what drugs are known to cause agranulocytosis? A helpful way to remember this is to remember that the C's, the carbamazepine, which is the seizure drug, clonazepine, which is an antipsychotic, colchicine, which is a gout drug, and then PTU and methimazole, which are your antithyroid medications, can also cause agranulocytosis. Next, hepatotoxic antiepileptics. The main two to know are valproic acid and carbamazepine. Next, what drug induces the cytochrome P450 system? Your mnemonic is Coronas, Guinness, and PBRs, Pabst Blue Ribbons, induce chronic alcoholism. Drugs that induce P450 are carbamazepine, griseofulvin, phenytoin, barbiturates, rifampin, St. John's wort, and chronic alcoholism. Okay guys, that's for the lecture, but we're itching to do a game show, and we're going to go straight to the end of session quiz after this, but try to yell out the answer before time is up, unless you're in the library, and then just think it really hard. Gingival hyperplasia, Stevens-Johnson syndrome, and a sodium channel blocker. That's phenytoin. First line for an absence seizure, blocks T-type calcium channels. That's ethosuximide. First line for status epilepticus, reversed by flumazenil and increases GABA action. That's the benzodiazepines. Trigeminal neuralgia, hepatotoxic and a P450 inducer. That's carbamazepine. Causes spina bifida, hepatotoxic, sodium channel blocker. That's valproic acid. Now, let's go to the end of session quiz. First question. In regards to seizures, what do the terms partial, simple, complex, and generalized mean? A partial seizure is located in a part of the brain, a specific area, like the temporal lobe. A simple seizure has no alteration of consciousness, and a complex seizure has alterations of consciousness. A generalized seizure generalizes over the whole entire brain. Next question. What are the most common causes of seizures in children? In children, a developmental etiology is most common. Other pediatric causes include infections, febrile seizures, trauma, and metabolic causes. Next question. A 10-year-old child spaces out in class, stops talking mid-sentence, and then continues as if nothing happened. During the spells, there's a slight quivering of the lips. What is your diagnosis? It's an absence seizure. What drugs are known for causing Stevens-Johnson syndrome? That's Steve Jobs made Apple PCs, allopurinol, phenytoin, phenobarbital, lamotrigine, ethosuximide, penicillin, carbamazepine, and sulfonamides. Last question. What are the toxic side effects of phenytoin? Phenytoin has given MDs frustration, peripheral neuropathy, hirsutism, gingival hyperplasia, megaloblastic anemia, drug-induced lupus, Stevens-Johnson syndrome, and fetal hydantoin syndrome. And a quick rapid-fire fact or two. Treatment for the absence seizures is ethosuximide, and the most common cause of seizures outside of the developed nations is neurocysticercosis caused by Tinea solium or pork tapeworms. So if you get a question about somebody traveling from another country to the United States having a seizure, that might be your cause. All right, guys, that brings us to the end of the lecture. Hope you learned something today. We'll see you at the next time.